Hey, I'm trying to live until I die. Come connect, you know it's a lewd state of mind. Yeah, yeah, talking traveling. If you wanna fly, fitness and finance, living a better life, keep it raw, no filter, living with no limit. Thank you for tuning in. Come on, let's get it.
Welcome to Lewd's State of Mind.
Thank you very much.
Thanks for coming along. I really appreciate your time. Do you want to tell our listeners and our viewers who you are and what you do?
Yeah, sure. So my name's Chris Reeves. I'm an osteopath, and I've got my own business in Parkdale. Been there coming up 20 years this year, so I feel like a bit of a dinosaur in the industry now. But Parkdale born and bred, and love living in the Bayside area.
20 years. It's a good solid effort, isn't it?
Yeah, a couple of decades. It's like, wow, where's that gone?
I know. Tell me about
Yeah.
it. Hey, is it true that they call you Superman?
Yes, it is. Yes, it's a tag I've never been able to quite shrug.
It's a good one, though, isn't it?
Yeah, it could be a lot worse, that's for sure.
I mean, it's very poignant. I mean, you're there to save the day, aren't you?
Yeah, well,
Pretty much.
And I've got this, I often let the patients down. They expect, rip open show the big S on the chest, but no, it doesn't happen.
That'll make a good promo ad for your business, wouldn't it?
Well, yeah, potentially.
You'd have all these young females knocking down your door.
God, don't start.
Well, tell me about, but how is business after 20 years?
Yeah.
How are we tracking? How are we going?
Yeah, look, it's an interesting industry, being a service industry. So, as much as it's a case of where we are dependent on people's pain. So when business is good, that's great for us, but it means there's a lot of people out there that are struggling. But at the end of the day, they're going to see someone. So if we can be the place where people can go to, then we're happy as well. So it's definitely been an industry of growth. So osteopathy being part of the allied health banner, it's one of the fastest growing allied health professions going around. So to see the growth over the 20 years has been nothing short of amazing, particularly in Melbourne.
Well, let's break it down for our listeners and viewers. What exactly do you do? What does an osteopath do?
Yeah, and again, 20 years in, I'm still getting asked this question every week. So it's one that can vary your answer as well. But while we've got some time, it's good to break it down. So as an osteopath, I'm a primary healthcare practitioner. So I've studied did a 5-year double degree course at Vic Uni.
So what were the 2 degrees that you had to train for as part of your qualifications?
So it's a master's in clinical science. Sorry, correct that. Bachelor of Clinical Science, which was the 3 years, and then a master's in Health Science, which was the 2 years. So,
okay, and that's all you needed to qualify. I say all. It's
5 years, mate. It was
I was going to say, I'll rephrase that.
Yeah.
You've invested a lot of time in qualifying as an osteopath, but was that the path that you set out right from the start? Was it like, I want to be an osteopath and I'm going to study and do this to get my qualifications? Or was it something that you fell upon when you started out to do something else?
Yeah, no. So for me personally, it was very much latter stages of high school. I knew I wanted to do something in the health science area. So when you go through open days and looking at different courses that were out there, again, we're talking 25 plus years ago, osteopathy was really a very small, low known course. So I was looking at physiotherapy, chiropractic, and then this osteopathy just sort of emerged into the background. And I thought, I'll look into that a little bit more. Spoke to my careers advisor at high school, and she said, look, I don't know much about this either, so why don't you go to an open day, check it out. And I really liked what was presented in the open day information sessions. So they sort of tapped into the philosophy of osteopathy, and that we can discuss that in a bit more detail as well. So from that, my initial interest was in health science. I was looking at physiotherapy, did some work experience, worked in the hospital setting, worked a day in the private practice setting, and I really liked the private practice setting. Hospital setting didn't appeal to me that much. And so when I realised osteopaths work primarily in private practice, that was another thing that really got my attention. The fact that it was very manually driven, so a very hands-on approach to healthcare, appealed to me as well. And the way it basically worked on how the whole body behaves and functions was also of interest to me. But I really did go into osteopathy quite as an 18-year-old, quite naive, quite blinded to, what I was in for.
But excited. You'd have to be excited about it, wouldn't it? What did you need qualification-wise at 18 to go the next step, to enter into the courses required?
So literally it was apply, attend an interview, get the appropriate enter score, or whatever they call it these days, the ATAR score.
Yeah.
And then it was straight in. So it wasn't like you needed to do a science course beforehand or anything like that. It was literally once you're into that, away you go and hang on for the ride basically for 5 years. Because as a cocky 18-year-old, you've done physical education, you think I know these bones and muscles, I'll be fine.
Well, 18, you know everything, don't you?
Exactly right. Yeah, nail it. And then, you hit first year and you go, whoa, what the hell?
It was a shock to the system, yeah?
Massive shock to the system.
Yeah.
And, you're having a bit of fun along the way. But
as you do.
The good thing about the way the course was set up was you were learning, you had to break down into subjects, for example, anatomy, physiology, biomechanics. But by the time you moved into like your second, third years, things started to come together and it started to make sense, how something was designed, how something behaved. And then along the way, you're doing the hands-on practical work. So you're starting to feel why is that moving that way? And if there's a restriction there, why is it happening? So,
cause and effect.
Yeah, exactly.
Yeah.
So by the time you've got to the end of the 5 years, you've got a good knowledge base of how the body works, but you've also got a better knowledge of how the body feels as well. And I think I really feel for the students over the last few years when we've gone through lockdowns and so forth, that your hands-on learning at university level was just stripped.
Yeah, exactly.
And how do you feel a strained muscle online?
Yeah. Well, especially if you don't know what you're supposed to be looking for. As you say, it's all very well to learn about it in theory, but if you can't feel it and feel the reaction to what you're doing, what's the point of doing it? You know? But as you say, you're very hands-on. That's all part of what you do on a day-to-day basis. I'm just going to read to you because I Googled osteopathy.
Yep.
All right, as you do.
Yeah.
Now, for our listeners, obviously, I'm a client of yours.
Yep.
I've been seeing you for some years, and to be quite honest, you're the type of person that I need in my life, like a Sparky and a few other people, because you're essential to my well-being and health. So just so they know the background, so that's the reason why you're sitting here.
Yep.
And the other reason why is that not a lot of people understand exactly what you guys do.
Yeah.
So it's about educating our guests. So osteopathy says medical speciality. Osteopathy is a type of pseudo-scientific system of alternative medicine that emphasises physical manipulation of the body's muscle tissue and bones. In most countries, practitioners of osteopathy are not medically trained or referred to as osteopaths. Do you agree with everything that's just been said?
No, not necessarily.
I don't either.
Yeah.
I don't either. So that takes us to the DR part as well too, because I googled what is a doctor? What define doctor?
Yeah.
And there's a lot of information about what they think is a doctor and what people perceive are not doctors.
Yeah.
Now this would say to me that you're not as qualified as what people think you are.
Yeah.
Would you agree with that?
It's interesting, the doctor example, because technically to be able to, call yourself a doctor, you've either done a doctorate in something or a PhD. But we haven't done that. But we are able to and legally able to use doctor as a courtesy title.
Yes.
Similar to what a dentist would.
Yep.
And same as, that along that line. So
because it says that a doctor is not a protected title, which means that you're able to use it. Now, by no means I'm trying to diminish what you do. I'm just trying to clarify to our listeners is that there's people that are called doctors, and then there's the true definition of a doctor. But that doesn't take away anything from what you do.
Yeah.
Correct.
Yeah.
Is that ever raised been raised throughout your career?
Yes, yeah. There was actually, we had a meeting just a few weeks ago that was for members of Osteopathy Australia to basically get together and just discuss where things are at.
Aren't you the chairman of that? I was reading on your website. You're on the committee?
I was on the committee for the public relations.
Okay.
So I was on that for about 14 years, but I did relinquish that role a couple of years ago, probably just before COVID, actually. Just out of coincidence. But yeah, that's another great topic to talk about, what I got to do there. But yeah, there was this meeting, and one of the members did throw open for discussion. You know, I feel uncomfortable with using the title doctor when I don't feel, you know, compared to someone who's done a PhD, they've earned that. How have we earned that? And, you know, it's a valid point, but on the flip side, you know, it was also mentioned that, well, you know, GPs, they haven't done a doctorate either. But
they're called doctors.
Exactly. So I think when it comes to, you know, are we able to use it and there's no legal reason why we can't use it, why would you stop using it?
Yeah.
And if, you know, the person down the road is going to do it and you don't, well, does that then undervalue you, even though you know within yourself you're on the same, you know, tier as them? But yeah,
How do you feel about it personally? The doctor versus no doctor.
Look, I think that I'd like to think that most people would see me not having even needing to think about that. They just have heard about what I've done. They know that, you know, my rapport is good. I'm in it for the patient's value. So I could happily drop the title today. It doesn't worry me. No, I'm not that.
Well, you've got street cred as it is, isn't it?
Yeah.
I mean, after 20 years of doing what you do, there's a reason why your clientele keep coming back to you.
Absolutely.
Yeah.
Yeah. And there's still, you know, when we write letters to, say, doctors, that is in GPs, and again, I refer to them as doctors, but when you write a referral, you know, to a specialist, I still, you know, do I still put the title, the doctor title there?
Yep.
And yeah, it doesn't sit 100% comfortably, for sure. But
are you allowed to write scripts for your clients?
No.
No.
Unfortunately,
Who are?
General practitioners and specialists, yeah. But,
so we're talking psychiatrists.
Yeah,
yes,
I think so.
Not chiropractors.
Not psychologists, I don't
No.
think. No, definitely not chiropractors. Then you go into more your alternative medicines, your naturopaths and that will be able to prescribe more natural remedies. Yeah. But when it comes to, you know, your pharmaceuticals, no, that's out of our scope. We do cover pharmacology as part of our training.
Yeah.
Yeah, that's sort of the limit. Yeah.
We're talking about naturopaths, just a slight diversion.
Mm.
Do you believe in the ethos of what they're trying to provide to their clients with natural remedies or natural healing? Does it fit with what you know about the human body?
Yeah.
Yeah?
Yeah, I think so. And you look at example of, you know, people with inflammatory disorders, and you look at, you know, key terms or words that you hear buzzing around now, things like turmeric and curcumin and all these natural, you know, derivatives. So yeah, it makes sense if you allow that extension to fall into what a naturopath would look at. Absolutely, it makes sense if you can introduce, be it supplements, substances into your system that's only going to be helpful.
Yeah.
Yeah, why not?
All for it.
Absolutely.
And anything natural
Yeah.
is good.
Yeah, I mean, it's just like any sort of field. You're going to get a spectrum of I guess, passion into that area. Some people will go really left of centre with what they believe is a suitable remedy, and unfortunately too, some people will take advantage of that. They will overprescribe maybe, or they will oversell a product that way.
Yeah.
But the genuine, you know, going back to the basics of, are there some natural solutions or supplements, additives that could help a person's well-being? And if they try it, and again, it's on that line of thinking that we'll try this. If it helps, we'll know within X amount of time. But if it hasn't helped, hasn't made that difference, we stop and reset and we look again. We don't just keep going if it's not making a change for that individual.
I suppose for some people they're just looking for a solution to a problem.
Yeah.
And a natural solution is where they go to.
Yep.
I'm a big believer in pharmaceuticals.
Yep.
Myself personally.
Yep.
Just from history and people I know and experiences.
Sure.
I believe in the science. I
Yeah.
definitely believe in the science, but I can understand how natural remedies
Yep.
can help in certain areas, but they're not a fix-all.
No, and
By no means.
yeah, exactly. And again, we'll have difficult conversations with patients. We'll have some that, will be very anti. Oh no, I can't take that. I just don't. I'd rather put up with the pain. And then you'll say, well, how are you sleeping? Yeah, nah, terrible.
Can you understand that comment though? I'd rather put up with the pain. Does that compute with you? Because for me personally, it's like there is an alternative to pain,
Yeah,
and you don't have to live with pain.
yeah,
Why wouldn't
Yeah.
Why wouldn't you?
yeah. And again, it's, I suppose if you put it into different contexts, we will say, well, okay, if you're in pain and then you take some pain relief medication or say a strong anti-inflammatory, it bombs off those pain signals, you feel great, and then you go out and then go and maybe run when you shouldn't have been told not
Yeah.
to run. Then you're sort of masking things, and that can then be to the detriment of your body,
Yeah.
because when that medication wears off, you might go, oh crap.
That all comes down
worse.
to education. Because I mean,
Absolutely.
like, as a 50-year-old man, I know that I've had that many injuries and I've done that much to my body.
Yep.
You get in tune with your body, and even if something is tweaked, you go, oh man, here we go. I'm in for weeks of recovery.
Yeah.
So it once again cause and effect, but it's about as you get older and smarter,
Yeah.
it's limiting that risk.
Yeah, and it's
But-
probably about the timing, So do you take that medication like before exercise, or is it more in a form of recovery? So again, you might then blend in with, okay, some supplements you might consider post-exercise bout might be, well, you've depleted some of your natural stores, like your magnesium levels might be waning, so you might supplement there. But also from an anti-inflammatory or a pain relief perspective, you might be looking at, well, one of the most important things we want is to rest and recover.
Yep.
So if we can optimize our sleep, then you might say, hey, there's some justification in taking some pain relief medication to help assist you getting to sleep, to get that restful sleep, get through all your sleep phases so you get that deep sleep. And
Well, we all agree that sleep is
Massive.
is massively important.
Yeah.
We've talked about this previously with
Yep.
previous guests on the podcast. It's so important, and also the recovery.
Yep.
The not slamming your body every day at the gym.
Yep.
Because your body's not going to give you time to recover. Hey, while we're talking about recovery in gyms,
Yep.
cramps. Talk to me about cramps. I'm going to take a sidebar here. I have suffered from cramping in my older age, and I know from experience I need salt. If I'm doing anything extreme like running,
Yep.
when I used to run, I used to take salt supplements. But is cramping a direct result of not enough salt in your system? Like, so I trained triceps, chest and triceps last night.
Yep.
I got home, I was helping my wife with something, and I was bending in such a way, and my triceps just cramped up, and
Yeah.
it was very, very uncomfortable. Now, are we saying that that's a direct result of not having enough salt, magnesium? Talk to me about it.
Yeah, look, I think we probably need to look at it even slightly more broadly in that, yes, sodium being the salt component absolutely is critical. It's about, you might have heard of that buzzword homeostasis, which is basically,
No, I've never heard of that.
it's basically balance. That's like having your body in that perfect balance. So if you have overworked an area, and as you say, if you've isolated load into a particular part of your body, then the relative minerals and nutrient level in that level will be challenged a bit more, which we want to then say, okay, how overall with your body can we restore that homeostasis? So one of the big things that I would say first and foremost with anyone dealing with cramps is firstly have a good look at what your water intake's been.
Okay, number one.
Number one,
Yep.
without question. And so many people, and particularly this time of year, when it's cold and wet and windy,
You're not bothering with
not bothering with water.
you having a cup of coffee or
And what does that do?
yeah.
So yeah, it can create that little, I wouldn't call it a massive vicious cycle, but definitely a subtle cycle.
So it's all these little things,
Yeah.
these little things that just need to pop into place to get that
Yep.
that nuance
Yeah.
and symmetry and
And your word's going to be homeostasis now. You're gonna
homeostasis.
use that.
It's another hard word I've got to pronounce. Homeostasis.
Yeah, but
yeah.
that ties in with, so with cramping, the muscle basically, without going into the nitty gritty of it, but muscles are designed to contract and relax. And so if you have done a session where you've really put some tensile load into that tissue, particularly where it's shortened quite a lot, it's almost like a magnetism where that muscle, if you let those fibers start sliding again into that contraction, and those minerals aren't there to open and shut the gates to allow that, those messages can get scrambled. And so instead of a nice slide, and then you go, oh, hang on, we haven't got the gate to shut,
Yeah.
and you got a cramp.
Wow.
And then you go,
That's how it happens.
well, yeah, in a nutshell, yeah.
Yeah.
And so we come back to water. We need to hydrate. We need to get blood volume up. We need, again, and it ties in quite well with one of the underpinning philosophies of an osteopath is about circulation. That's the founder of osteopathy had one of his key philosophies was the artery rules supreme. So basically, we need to optimize blood flow through our whole body.
I'm just going to stop you there. Who was the founder of osteopathy?
Yeah, he was an American. He was actually a physician. His name was Andrew Taylor Still.
Mav, can you Google search that for me, please? I want to have a look at this rooster.
Oh, he's an interesting.
How many?
He could have been Colonel Sanders' brother when you see photos of him.
What year are we talking?
Oh, 18. Horses testing me, 1860s, I think.
I did ask you to research before you came in.
Oh, I failed that one.
That's
man.
all right.
We'll soon-
That's what Google's
soon
is for.
see.
Yeah, Mav. Look at him. Is that him there on the left? Do you want to pull that
Yeah.
picture up, Mav? Andrew Taylor Still.
Yeah. So he, as I said, he was an American physician who, back around his time, there was
Just keep that picture up.
there was lots of issues with disease, like smallpox was particularly rampant. And he got quite jaded with the way the modern medical field at the time was handling illness, and he basically started, well, I guess you'd call it dabbling with hands-on therapy to see if that would improve how a person's well-being could be optimized. So again, my historical recollection of it is a little bit shady, but I believe he may have lost children to disease, and that really
Can you do a wiki page on him, mate?
Yeah.
Probably have some more information.
Yeah, that sort
it's
of
interesting.
Inspired him to think, bugger this, I need to look more into how we can, help bodies improve.
Losing a few kids will help you, won't it?
Exactly.
Give you motivation at the wazoo.
But improve in how the body can fight disease. So he was working with this premise of, well, if we can improve circulation, if we can, restore mobility and function, structure and function are then interrelated. So again, if you've got a poorly moving part, that's going to affect, the function of the individual. So sometimes he would say, well, all right, if we can align that structure a bit better, and that's where some joint manipulation and that came about, even just mobilising joints, then that seemed to have a positive effect.
So he's definitely thinking outside the box,
Absolutely.
isn't he?
Yes.
Here we go. The part that I've highlighted. That's.
Can you just blow that whole screen up? Or
Yeah,
not?
I'll see if I can.
You know how blind I am.
Well, there you go. Death of his wife as well. There you go.
Wife and 3 children. And an adopted child.
So after the Civil War and following the death of his wife, 3 of his children and an adopted child from spinal meningitis in 1864, Still concluded that the orthodox medical practices of his day were frequently ineffective and sometimes harmful. Now, that sometimes harmful, I can imagine in that era there's a lot of stuff being ingested and prescribed that wasn't exactly grade A pharmaceutical.
Yeah, exactly.
So,
Yeah. Yeah, so as you said, he was definitely a pioneer with really trying different things to see if that could have some sort of positive effect. And yeah, I mean, this is obviously before you can like talk about evidence-based medicine today. That's what it's all about. It's about testing something and then running a theory and then doing all your research to back it up. So he was very much.
Well, he's the innovator. He was
flying by the seat of his pants.
Mate,
but
good on him.
Yeah.
That's a little bit of history we all didn't know.
There you go. And
Thank you very much.
I was all right. I got 1860s as well.
You did, mate.
Yeah.
That was well done. Congratulations.
I passed.
Congratulations. Hey, we're going to take a little break. We talked about Buckfast earlier on. It's one of our sponsors here on the show, so it would be rude if we didn't indulge in a little bit of it.
Absolutely.
It's a tonic wine, and it's got a lot of caffeine in it. So
It's got water in it as well for your cramps. That's
yeah,
fine.
well, it's got all those essential vitamins in that for me as well too. So, oh, and it's made by monks. So,
Oh, thank you very much.
cheers. Here's to Buckfast.
Absolutely. Oh yeah, that's good.
It's been. I think it was a little bit watered down from that ice that had been sitting there, but you get the idea.
Yep.
I call it my speaking juice. It's good. So where were we? We were talking about cramps.
Yes.
We went off on a big sidebar there. Now, getting back to what you do in your practice,
Yep.
you've been doing it 20 years in Parkdale
Yep.
at the same location.
No.
Is it the same location on the corner there, or have you moved?
Yeah. Sorry.
I've always known you. Did you look at my client file the first time I came to see you? You didn't do your homework on me?
No.
No?
Trying to think. So, technically I've been at the same place for 20 years. It'll be 20 years this September.
Yep.
But I was practicing for a couple of years before that. So when I first graduated, I actually set up the spare room at my parents' place, which was just in Parkdale.
Handy.
It was very handy, and I was very, very grateful to have that opportunity, keeping overheads down, and it gave me a chance to build up a patient base. And again, back then, the internet's only really an emerging thing. It was more about, back then was like letterbox drops, and an ad in the local paper was a massive win. It was before any social media marketing was available, so it was a bit of a grind, sort of getting the ball rolling with patients, and then it was one of those things that organically grew.
Was there ever a time that you lost faith in it and thought, what am I doing?
No.
No?
It was
Good
always,
on you for sticking it out, because
yeah.
a lot of people would just go, this is not working. But you've invested a lot of time in qualifying to do what you want to do, and to just throw it away would just be a shame.
Yeah, look, it was definitely a learning curve, and I suppose I was a little bit. I suppose the pathway I took was slightly different from someone that may have gained work in an existing place and learnt, did their apprenticeship, so to speak, that way. So, for me, taking up, setting up my own practice straight away was a massive leap. You look back in hindsight and you think, what would I do differently? And there's a lot of things that you'd look upon now and go, well, it would have been nice to have had a bit more business acumen, just knowing basics, accounting, marketing, how to network that little bit better. So, because you've come from 5 years of science. So
were you always outwardly outgoing and personable?
Oh, me?
Yeah. Do you consider yourself that?
I consider myself actually pretty shy and pretty quiet. I'm more of an introverted type, I would say, but I'm not afraid to talk. I'm not one to just throw it out there what I think. I'm more one to sit back, listen, absorb.
Yeah, you're like me. Yeah.
And then if I've got something to say, then I'd like to get that across. But I'm also comfortable in my own space. I don't need to hear my voice. And it's funny, like my wife will often. I'll get home from work and she'll go, you're a bit quiet. I said, well, I've just had 14 different personalities I've had to talk to, you know, so I just need a little bit of time just to have a, yeah.
Do you consciously, talking about your clients, you consciously decide to engage with them on a regular basis through the treatment? Because sometimes I often find it. Sometimes the quietness of it all is it's relaxing. It's my time out from my busy day.
Yeah. I think it's really about reading the room.
Yeah.
You know, so I would see, someone like yourself, we have a quick chat, work out what's going on, what we need to do. And it's about, all right, this is the plan for today. This is what we'll do. And you'll go, yep, sweet, no worries. And then into it we go. And every now and then there's a little bit of, you know, is that pressure okay? Is that all right? Yep, cool, no worries. There'll be others that just will not stop talking, you know, and you just get, there's a lot of, yeah.
Well, you know, you're a psychiatrist as well,
Mate,
too. I mean, because
totally.
that's what they come to see you for. It's not just the hands-on stuff.
Yep.
It's the mental side as well, too.
Spot on. So yeah, there will be days where you feel I didn't feel I was as hands-on today, but what I talked through and discussed with my patients was just as effective, or just as important for them.
Yeah,
And
exactly.
I think what I've learned over time is it not sound very basic, but it's absolutely critical that you listen to the patient. You know, you can't prejudge. You just have to listen to what is going on, and from that ascertaining, first and foremost, have we got a condition or issue here that is beyond my scope? Do I need to refer on? And if not, no, okay, you're in the right place. I want to hear what your issue is. What are your goals as well? How can we help steer you towards those goals? And then it's about, and the beauty of my job too is that we are hands-on, but we've got a lot of different treatment techniques we can throw at the patient. You know, and that's where, call it the challenge lies. It's about selection. What do I think will work best for you?
Do we want to I was going to say quickly run through those treatment options? There's probably a long list of them.
Yep.
Let's start from the top five.
Okay, so more often than not, we're going to do a lot of soft tissue work to release muscle tension. So massaging would still be primarily a big go-to that we will do with not every, but with most of your treatments. So I would look at it again that as an osteopath, we're trying to look at how the whole body is behaving. So that takes into account the musculoskeletal system, the circulatory system, the nervous system, lymphatic system, etc. So we can then say, well, my hands-on approach is then trying to optimize all those tissues. But say, for example, massaging, that's probably going to have a bit more of a direct effect on the muscular system and the circulatory and lymphatic systems, because you're promoting that movement of fluid through those tissues.
Yep.
Then we would move into more, the structural type work might be more what you'd call joint play. So articulate the joint, mobilize it, manipulate it, depending on, again, what you're dealing with, the patient type, their previous medical history. All of that becomes really important before you make your determination as to the most suitable and call it safe practice to apply as well. You know, so that would then lead into, on top of your mobilizing work, we might then stretch out where there's either muscle. There's another key word that you'll hear often too is fascia. So fascia is like the connective tissue that binds things together.
I've heard you use that before.
Yeah. So often we'll get a lot of this, what we call fascial bind, and that can really impede, again, on movement patterns and quality of movement. So there'll be a combination of work done on the soft tissues, then that includes the fascia as well. A big component of what we'll do these days, and it's become more and more popular, is the addition of things like dry needling as well.
Now that's different. Is that same or different to acupuncture?
It's actually different.
Yep.
Yeah, and it's clear I try to make that very clear with my patients as well.
Can you give us the difference between the two?
Yeah. Basically, acupuncture is, it's actually, to study, to apply acupuncture, you need to study for a number of years. It's actually quite an in-depth field that basically aligns itself with traditional Chinese medicine practices. So it delves, and I don't know, again, not having studied it, I don't want to discredit or say something that might be out of line. But
No, that's fair enough.
I have a lot of respect for the practitioners of acupuncture, because it's very involved, and it deals with energy flow and things like chi and imbalances along those pathways. So hence, when I say if you see an acupuncturist, chances are you're probably going to get needled in a whole range of different areas in the body. Whereas when we practice dry needling, it's very specific to more what we call tight bands, which we know as trigger points that are in muscle or in tendon. So we're trying to basically elicit a responsive change in that trigger point to try to release it so that it's not causing pain. When you look at the nitty-gritty of what a needle is doing, it's actually a noxious stimulus. It's actually something going into the body to literally piss it off.
Yep.
And what that's trying to then do is generate a more localized inflammatory response to then promote better healing and repair.
Okay. Well, everything you've just talked about is what you do to me on a bi-weekly basis at the moment. So I've got bad shoulders.
Yep.
And I had a recent accident snowboarding and did them both again. One was worse than the other.
Yep.
But exactly what you've just explained to me is identifying what the problem is for a start, and then working out, as you say, with the massage, because basically if you explain to our listeners, all my shoulder's trying to do is protect itself at the moment. So everything's binding up around it and trying to protect it, which restricts the movement of it. So me trying to lift my arm up over my head doesn't happen because of all these muscles that are just binding up and tightening up. Is that a correct summation of? Have I listened to you correctly?
Yeah, no, you have.
I mean, I've done it 3 or 4 times with the same injury, so
Yeah.
I'm very familiar with it, and I understand what's happened, and I understand how you treat it and how it affects the release of those muscles, and especially with the dry needling. And if our listeners have never had it, it is like a reaction in the muscle. It'll flitch.
Yeah, yeah. So when you experience that twitch or that flinching feeling, it's what we call a local twitch response. So that's actually a good indicator that the needle is probing into a good area.
That's the result that you want. Is that correct, or does it not matter whether you get that twitch?
Yeah, from what I've read, the studies say that there's no real difference between getting a twitch response or not. I don't know. I think personally, you feel it's good when you see or feel, or the patient feels that response. There's that little bit of a connect there that they feel, hey, that's actually done something, because I genuinely felt something involuntary happen in my system. So, but different body types and different muscles within the body that you work might have different reactions as well. Like sometimes people might experience more of a dull, vague ache that's hard to localize as well. And that again is another way that some people with active trigger points, that's what they feel. They just feel this hard to localize ache. And you go, great, we've reproduced that, then we know we're in the right ballpark of then trying to calm that down. Yeah. So
How far do they go in? Do you know? Can you?
Do you really want to know?
Yeah, I do.
So, needles can differ in their size. We have anywhere from 30 mil to 75 mil.
So 30 mil is this big?
Yep.
And 75 mil is that big?
Yep.
So
Now,
you normally use the big ones on me?
around your shoulder, no.
The small ones?
Yeah, and that's plenty enough to penetrate into those key tissues around your shoulder girdle. Now, what you got to bear in mind is when you're applying this approach, you've got to be very careful of the other structures that are within the body as well.
Oh, you've got veins, you've got bones, you've got...
And what's under your shoulder blade?
What's under it?
Yeah. Your lungs.
Lungs.
Yeah. Do we want to put a needle into your lung?
No.
So
So you're saying a 75 mil needle, if put
So I'm not going
near my shoulder blade,
Yeah, so I'm not going to
would
use
go
that.
in your lung?
No. So you'd
What
use...
would just hold on to it, because I'm intrigued. What would happen if you punctured my lung with a 75 mil needle? If somebody went and my shoulder blade into my lung.
You probably feel a bit like Paddy Dangerfield did last weekend.
Oh, really?
Yeah, you
Just got the stuffing knocked out of you.
Yeah, short of breath and possibly some pain, you know, on inspiration. But thankfully, I've never encountered that. And the reason
I wasn't
is,
ensuring that you were. It's just my mind going, what would happen?
Yeah,
you know?
so it's about the practitioner needs to understand the surface anatomy. They need to understand what's underneath the skin so that they can apply needles within, whether it be the right depth and also the right angle as
Yep.
well. So we talk about, you know, you can, if a person's laying down flat on the table, if you're working down the spinal column, you're still going to probably go in on a slight transverse angle. If you're working,
So you're not heading towards the
the
spinal cord.
Yeah, and you're using bone as a barrier. So
Yep.
and that's where a shoulder blade, for example, is a good barrier. But the shoulder blade itself is actually still very thin. So you don't want to go straight down. So you're going to go in on an angle.
Yep.
And again, you're going to use maybe 30 mil needle around that shoulder, whereas you might use a 75 mil needle into the glute, which
Yep.
is, you know, the biggest muscle in the body.
Yes.
So that's
Is
where
it?
Yep. So the rump.
Your bum.
Yeah, your ass. So you got a lot more.
I did not. I thought it could maybe a quad or something like that would be
Yeah.
bigger than your ass.
Yeah,
Huh?
yeah. No, I mean the quad is a grouping of muscles.
Yes.
So yeah, when you
So the one individual muscle
Yeah.
of your bum is the biggest.
I mean the glute as well is broken down to three components. You got maximus, medius, and minimus.
Yeah.
But the maximus is the
That's
name
interesting. I
implies.
did
yeah.
not know that.
There you go. Yeah. So, but yeah, needling again. Going back to that original question about different treatment techniques. Yeah. So soft tissue, then mobilizing, moving the joints, stretching things out. Some needling as an option, and then we really focus a lot too on exercise prescription.
Yes.
As well.
Yeah. You always tell me before I get out the
Give
door.
you
You
your
always got a
homework.
new one too.
Yeah.
They all work, by the way.
Yeah, we got to, again, it's about, and this is again over time, you know, when you first, you want to set the world on fire with fixing everyone, and you give them 20 exercises, and over time you realise the compliance will not be there.
They're never going to do it.
Nah, you got to.
They'll do it once and then that's it.
Yeah, so you got to find, you know, ways to motivate and find that buy-in where a patient will go, yeah, I can do that. That's realistic, and that's then sustainable. And it's when you can start to work that way alongside the patient, they're then getting their own independence back and ownership on, hey, I'm getting on top of this now.
Yeah.
And that's huge.
Do you get frustrated when your clients don't listen to you and you know they haven't listened to you and they haven't done what you've prescribed? That pisses you off? It's like being a personal trainer and
Yeah.
they go home and eat KFC every night.
Yeah, look, I think it can get frustrating at times because you're investing your expertise and energy into that person, and you know that if they do it, it will help. And that's where it can be frustrating. You think, oh, if only, and it's again where, well, what else are they doing? You know, that they should be doing. And I've probably changed maybe tact in over the years where instead of being so specific with, right, the stretch has to be this or it has to be that, it's more about just move.
Yep.
Just move for me. What movements do you like to do? Oh, you like to dance. Great. Put your favourite song on and dance. One track. That's all I ask. You know, and then you're moving. So if you've sat at the computer for an hour, too long, sit there for half an hour, throw a song on.
Yep.
And then sit back down again for another half hour.
Hey, moving, that comes to a famous quote that's on Danny Kennedy's wall, which is, we don't stop moving because we grow old because we stop moving.
Yes. Yeah. And
how about that? That every time I see that, as I get older, it's like, yes.
Yeah. And I think that I see a lot and hear a lot of. The patient comes in and the first thing they say is, oh, I'm getting old.
Aren't we all?
And it's like, yeah, we are getting old, and yes, tissues change, and we can't disregard that, but we shouldn't just use that as an excuse. It's more what we will see is our body becomes deconditioned to something because we've either stopped doing it, and we just need to find that spark.
I hate to use that cause and effect thing again, but it's exactly it. There's nothing else describes it. You know, it's.
And COVID was a great example, right? Of, you know, people had set routines. They would go to the gym. They would walk 10Ks, whatever it may be, And then all of a sudden, lockdown, no gyms, a good percentage would move to online sort of training, awesome, but there's a lot that didn't. Oh, you're now restricted to a 5K radius, right? Well, I'm not going to walk as far, and so on. And all of a sudden, bodies aren't being challenged the way they happily were. And then we come out of a lockdown and it's like, right, back to the gym, let's dive into it, let's make up for lost time.
Good for you. A lot of injuries.
Mate, it was crazy. So, yeah, and then we are, yes, applying a lot of treatment to try to help people, but obviously we want to be proactive with everyone's health. So we're educating constantly. Hey, are you aware when you've had this time off, you've got to progressively reload?
Yeah, it's the same with anything though. Educate.
It is.
Educate, regulate, and educate.
Yep.
Now we talked about COVID. COVID was a shitty time for everybody. It was probably shitty for you as well too. Although you could still operate.
Yeah, it was definitely tough. Yes, you're right. We could operate, but it was very restricted. So we were only able to see urgent patients, and again, it was like we had to create the criteria for what's deemed urgent. So it was very...
You yourself had to
pretty
create
much.
that, yeah?
Yep. So we had to triage basically patients that were, calling us up or making inquiries, and we had to basically go through the, would this put you in hospital if you weren't seen to right now? Yeah, okay, well, that's urgent. You need to come in. So we were thankfully able to still operate in some capacity. And then, you come out of a lockdown and then you just be surged. Yeah. And that was hard for everyone, again, for the staff. So one of my, concerns was making sure my staff were okay as well.
So you got government funding through COVID?
Yes.
Yep.
Yes. Yeah. Thankfully, it was a great initiative. One of the good things that did come about was just helping businesses stay afloat. So when you knew that, you had to abide by the rules and regulations that you could. So you knew that, come the back end of things, that you would be able to, kick off again and make sure that everyone was, not just financially, comfortable, but, within your own mental well-being that, hey, we're fine. We'll be able to get through and then continue to do what we love to do.
So that would have meant that restricted the amount of practitioners you had in your practice.
Yeah, I mean, there was like the density quotients and, how many people could sit in the waiting room at any given time.
Yep.
We had to, split shifts, so there was not so much crossover. And all this we had to create ourselves. There was no... there's
no set guidelines on that sort of stuff.
There was no rule book that said, this is, in the event of a pandemic, this is what you do. So there was a lot of just, the cliche of just pivoting, shifting, and just rolling with the punches. Yeah.
How many staff do you have? How many employees?
So we've got 6 osteopaths, a couple of massage therapists, a yoga instructor, and a couple of part-time reception staff and a couple of casual reception staff as well.
That's a pretty big crew, isn't it?
Yeah, it's good, and it's a great crew. Love them all.
Yeah, I looked them up on your website. They're good-looking roosters, like yourself.
Well, that's not...
Is that your criteria?
Yeah, I was going to say, there's a real strict screening policy, Brendan, about that. Yeah, and guess who gets to vet it? No.
I'd never get a job there. Not good looking enough.
You'd be right. You'd be right.
So, COVID, you personally, did you feel like, was there a sense of doom? That was it, hey, we've just got to put our big boy pants on and just soldier on, or was there some concern internally?
No, I think in the early stages, and I suppose it's, Melbourne seemed to be the place that copped a real hard time, and there was just this constant stress, and it was almost like you were living every day by, the 10 a.m. briefing. How many numbers today? And it just, you could see the anxiety rising every day about these damn numbers, and and when you look back now and you think, God, we were peaking over like 22 cases. Now, I'm not saying that to disrespect those 22 at the time, but relative to numbers and what we had to endure, there was definitely, that early stage where you think, oh my God, are we going to be like this forever? And so you can't help but think about your business and your livelihood that way. But no, I think, common sense prevails as well. And you think, well, clearly if we can, follow the whole, medical advice that was given, get more people vaccinated, we can get back out and about, protect, the whole herd immunity thing, and we can get on with life a bit better. I think that certainly, made people see that, we'll be fine. It was probably, when you had periods where, I've got 2 young boys, it was about their well-being. I think you straight away as a parent, you always think, well, are they okay? And that was of utmost importance for my wife and I. So homeschooling was interesting
For everybody. It was fun, wasn't it?
Oh yeah, don't know if I'd use fun, but it definitely started with F.
If you day drink, it's even fun. It's even more fun, isn't it?
Yeah. I'd be onto that buckfast a hell of a lot more, that's for sure. I think it was about how do you try to make a positive out of the situation? Try to keep the cup half full. And so for us, it was more about, well, family time was great. We actually could sit and have a meal as a family instead of, you're running out the door to a training session, or I'm late at work or early start. So you sort of go, okay, well, this is time to, tap in and connect again. I personally found, for me, when we had time to do a bit of exercise, I decided to start swimming in the bay, doing the cold water sort of swims, and for me that was such an amazing outlet. And you meet a few people down there that are going through the same sort of challenge, and it was quite a good time to. It was only be a few minutes to start off with, but you sort of, you're going for a little bit longer, and you start to create this little, it's like a little tribe down there. So that was a really nice positive experience that I had, and I still maintain the cold water swimming as today. It's
great for you. You saw my ice bath downstairs.
I did.
Yeah. I freaking hate it, but I know the health benefits of it, and everybody can do their own research on it.
Yeah, exactly.
I'm only like 3 minutes. 3 minutes for about 3 times a week.
Yeah, that's good.
It's like going to the dentist. It's like the anticipation and the angst of what you think's going to happen, and then it's over and done with.
Yeah.
And you're out the door. Luckily, there's not a big bill though.
Yeah.
So, hey, look, personally, as a healthcare professional, were you personally concerned about COVID? Were you concerned for your health, or were you thinking, it's just a version of the cold?
Yeah, exactly. I think that's more how I was thinking. I wasn't seeing it as a life-threatening issue for me. I mean, thankfully, touch wood, I've been very fortunate with my health, so I felt from my constitution point of view, if something was to infect me, I think I'd have a good capacity to handle it. But then, obviously you'd have conversations about, to get vaccinated, not to get vaccinated, and I was always, inclined to get vaccinated and follow again the recommended health advice. And as another way of safeguarding against, should you get it, you don't want to be that maybe that rare percentage that does suffer quite extensively from it, because there were cases where you would hear someone's in hospital, you think, geez, I thought they were pretty robust sort of person.
Yeah. So, it's weird, isn't it? I mean,
think
generally underlying health issues did exacerbate it.
Yeah, and I think the media have got a lot to answer for the scare tactics, and I think because it was almost like this. It was a new monster. We don't know enough. Has it got fangs and venom? We're sort of all in the unknown. So unfortunately, again, there was this fear generated amongst Yeah,
and being constantly bombarded by the media about it.
Yeah,
it was a shitty fucking period.
Totally.
For everybody and everybody. So coming out of COVID, business bounced back as it did with a lot of businesses.
Yeah.
You were saying that the injuries that people were getting after COVID were due to stuff that they weren't doing during COVID.
Yeah.
Is that how you explained it earlier on? That so people weren't going to the gym, and then obviously they're going back to the gym.
Yep.
If we're talking about injuries, what's the most common injury you treat as an osteopath?
Yeah, I think Look, we'll often see through our door spinal pain. Now, whether that be lower back pain, neck pain in particular, probably what has, again, from a trend perspective, I think, apart from having snowboarding accidents, but shoulder injuries have definitely been a little bit more prevalent in recent times. Now, whether that's a whole host of causes, and that's what we try to delve into with each patient is, well, why have you got a sore shoulder versus someone else for a different reason? So it could be...
Do you keep a database on this type of trending or any sort of information collecting about injuries and the cause of them, and document it at any point so you can go, oh, we're seeing a trend here with this injury and it's because of certain sports? Is that information?
Mate, if I had spare time to do that, that would be...
I get it.
That
I
would
understand.
Be a great thing to do.
Yeah, maybe you do that when you retire.
Yeah.
That's probably the last thing you want to think about when you retire.
But it does, again, it comes back to, the cause and effect. If we can understand what may lead to dysfunction in the first place, and if we can educate a broader group, as say, kids sitting on PS4s or PS5s or, Xboxes, and it's about, we can't stop them, right? They're going to do it. They enjoy it. It's their outlet.
Yep.
But let's just try to educate them a little bit around, all right, well, if you're playing a game that works off levels, play that level, and then before you move into the next level, just get up and move for a bit.
Yep.
Goes back
Are you
to
listening to this, Maverick?
Yeah, I was just saying.
Yeah.
Pricked up, yeah.
Yeah.
Just, it doesn't have to be a half-hour stretching session. It's just move for 30 seconds.
Geez, even getting out of your room, Maverick.
Yeah.
That'd be nice.
I'll get out of my room.
Hold on a tick. Calm down there, big fella. We're not attacking you. We're just suggesting that we want you to have a better life. This is what it's all about here at Leeward.
That's right. So I think, we certainly would see conditions. Again, going back to your original question, spinal pain for sure.
Is that a big one, is it?
Yeah.
Are we talking about in the latter stages of life, or are we talking across the board age-wise?
Look, I think the classic sort of mechanical back pain issue, you're probably going to see with more prevalence from, say, mid-20s and upwards. That's the joy of juvenile tissue, teenagers and that, they can get away with it. They can sit crappy for a while, but it still has a stack-up effect. But we still want to advocate this whole move and improve mentality with posture. But, it's again where... be it the job you do, the sports you play, the genetic factors you may have inherited, some of those things can certainly predispose one to more back pain. I mean, the stats they're pretty alarming about the incidence of back pain in a person's lifetime. So
wow. It's
like 85%.
Touch wood, I'm good so far. It's everything else that's falling apart around me. So we're talking about posture. Now, with the youth of today, and even older people with cramping over devices and their laptops and stuff, you're seeing more injuries, issues because of that.
Yeah, even just the position you're in straight away is like, well, what's that? Yeah, what's that doing to your neck, your shoulders, your elbows, your thumbs even? There's that. I mean, we've even got classic terms now, haven't we? Like text thumb.
Oh, is that a thing?
Yeah.
Yeah.
So, repetitive strain from, smashing away out, texts or, scrolling through your feeds and all that. So, it's repetitive strain, tendonitis, arthritic changes.
Is that where that hurts in there? Is that... Man, that shouldn't be the case with me. You've noticed that I've set up through the whole interview.
Yeah.
But I actually do try to do it on a regular basis because I know from history, and I've seen the results of doing things correctly.
Yeah.
And especially when you exercise and you train and you want a good looking physique.
Yep.
It looks worse when you're cramped over like this.
Yeah.
So
it's amazing, like how much the advice has changed in 20 odd years. When I first was practicing, the advice very much was you need to sit erect, and that's it. Basically, hold that, and that's good posture, and you'll be fine. But who can do that? You know, we
Well, no.
we can't sustain that.
No.
And before we know it, we are, oh God, I just need a break, you know. So what we're trying to again advocate now is let's move and improve. Your next posture is your best posture. You know, so
Your next posture is your best posture.
Your best posture is your next posture. Get that right.
Sounds like a T-shirt to me.
Yeah. So it's more about that. And then if you can work on some strength, you know, a couple of times a week to support those stabilizing muscles that stabilize your spine and stabilize your shoulder blades, and work out if there are any imbalances in muscle tension versus, you know, so lengthened and weakened muscles versus tight contracted muscles. We want to try to iron out those imbalances. So that comes with, you know, forms of, be it stretching or getting on a roller or a spiky ball. But what we're trying to then help is improve the resilience of those tissues to then sustain a position before they need, or they have to change before they become pathological, as in strained, inflamed, and so on.
So you've seen a lot of injuries as a result of just people being out of shape and not having good muscle structure, or not moving and using and promoting muscle growth.
Pretty much. And it's
is that just age, or is it?
Yeah, it's a good question, because we can't avoid the fact that as we age, we will lose muscle mass. So we do have to work harder at preserving that.
Yep.
And yes, joints will lose a bit of lubrication. So we do need to work at moving those joints.
Let's just talk lubricating joints.
Yep.
So explain to me how my joint's lubricated.
So
My shoulder or my knee, we're talking about lubrication.
yep.
Explain to me how it's lubricated and how that can be diminished.
So a couple of things. Our joints will naturally produce a lubricant, which we refer, depending on, if we talk about, use the example of a knee joint. That's a classic hinge joint. So it sort of moves into that flexion extension predominantly. There's degrees of rotation, but primarily it will hinge. And so the joint has a natural substance in it that's called synovial fluid. So the synovial fluid is the oil.
And that's naturally produced.
That's naturally produced
on like a daily basis, an hourly basis. It just does that diminish as you get older?
It can, and again, if we aren't moving that joint through full range, that can then affect the coating or lubricating through that entire joint itself. So we again want to try to encourage body parts moving through full range.
Okay, so say for instance a knee, full range would be me sitting down to standing up. Is that full range?
Yep.
It doesn't go any further than that.
No, that's right. So, and that's a good example of what we might encourage our patients to do, particularly ones that are prone to lower limb issues, is you've been sitting for a while, whether it be doing the crossword, you've been on the computer, but after that 20, 30 minutes, just sit and stand 5 times in a row, and you're lubricating your knee. Done.
Easy as that.
Easy. You don't have to go to the gym and do 1,000 squats to lubricate the knee.
No.
You know, you just need to get that joint moving through its natural motion, and you've job done. Yeah. So it's just, it comes back again to our education and really trying to make it real and attainable for a patient and for anyone. You know, just it's all about optimizing, because again, it goes back to, we're all different, we all have different genetic makeup. So, you know, one person may be more predisposed to osteoarthritic change in the knee versus another person that has a healthy knee. But you can x-ray, you know, grab 50 people down the street, x-ray their knees, and you might look at it and go, wow, that looks quite funky. There's a lot of changes that have occurred within that knee that might reflect osteoarthritic change, but they're fine.
Funky. I like to use the
really,
word
really
funky.
technical jargon there, but they're functioning okay. They're not in pain. They are, you know, they'd be none the wiser. Then there's another knee that you'd look at and go, that looks fine, and they're crippled. They're in pain. They're stiff. They're sore, and sometimes you think, how the hell? It doesn't always marry up. So an important thing that we need to do as therapists is correlate symptoms with findings, you know, both examination findings and maybe further investigations to make sure, hey, that is consistent with what we're expecting to see. Now, these are what what measures and protocols we may need to put in place to initiate change to help you get better.
Well, if we use me as an example, you did exactly that with my hip. So I had my hip replaced in 2016, I think it was. But the 2 years prior to that, I was in and out of your office on a weekly basis, getting needling because of the pain of the muscles and everything being restricted. It was just putting more pressure on it. So that's exactly what you did for me. We understood by X-ray that, hey, your joint's arthritic. There's nothing you can do about it. It's going to continue to deteriorate. And that's I was running at that stage up until that point where I just couldn't run anymore because of the pain. And then it was just managing that pain through your therapy to get me through to the point where it had to be replaced. But that was a godsend. And it was something that you couldn't live without. And when people say about living with pain, it was only after I had the operation I go, I dug it out for 2 years.
Exactly.
And in hindsight, you probably wouldn't want to do that, but sometimes that's just the way it is.
Oh, and that's right. And look, it's a big call to stare down the barrel of surgery, particularly at a young age as well. But
I wasn't that young.
I was trying to give you a plug there, mate. But we need to also look at it from the whole body perspective and say, well, if you're overprotecting and guarding that hip, what is the rest of your body doing?
Well, you're limping, and then you've got...
And all of a sudden, the back's now playing up. My knee's now getting funky. So it's really about trying to offset the compensatory strains that could ensue if we don't address that primary area.
Well, look, a prime example is if your knee's sore, it could be your IT band, it could be many other things involved, and sometimes it can be as simple as the IT band that just needs a bit of a rollout. But if you've never discovered that or never known that, you wouldn't know to just simply roll it out. So,
and that again, it ties in well with how we like to look at things from an osteo's viewpoint, is that whole body connect. So a good example is that knee pain. So we're going to not just dive straight into that knee and just say, we just need to lubricate that knee joint, you'll be fine. Well, we need to look at the surrounding mechanics. What's happening from the ground up? How's your ankle moving? What are your arches like? Or what's your balance like? How are your hips moving? What's your pelvic symmetry like? What sort of mobility are you getting through your spinal column? All of that can impart an effect onto that area. So then we will and it's again comes back to our education of explaining why you're working on my pelvis when I've got a sore knee. Well, it's for these reasons. And
a lot of people don't understand how the mechanics work. Now, if we're talking about osteopaths compared to chiropractors, what's your outlook, your professional outlook on chiropractors?
Look, I'm always a bit guarded with this one because I've never studied along those lines.
Okay, well, tell me what
I've never seen one, actually, to be honest.
Tell me what you personally think about chiropractors as healthcare professionals.
Look, they're recognised under the Allied Health Practitioner Regulation Agency, same as osteopaths, same as physiotherapists. So, they've been around about the same time as what osteopathy has as well. Look, their model, and I think it's a challenging one to answer because you might see chiropractor A and then chiropractor B and get a completely different treatment. You might see one that focuses more on spinal adjustments, and it's all about their philosophy based around a vertebral subluxation, where there's an element of disharmony in how that spinal column's moving. And if there's a belief in improving that subluxation, that improves the nervous system's capacity to then function better. So a lot of, historically, and I'm talking very, very generally here, but a lot of people will align a chiropractic visit with a quick 5-10 minute crack, 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 and you're sort of in and out and you're done. Now that, for some people, they love. It's efficient, it gives them a quick release, and away they go.
But does it fix the problem?
Well, you might then say, well, how many visits does that person have over a year, over many years? And it could be very, very regular visits. So it comes down to what the person wants. Do they want that immediate, call it gratification of a sense of relief, and does that work for them? Then that's fine. It's just not how would look at trying to help people.
I'm going to call them quacks, mate. Personally, that's my opinion, because I've had experience with them.
Yep.
I've dealt with them. I've known people, family, friends that have dealt with them. And I just don't understand why you would go back and try to fix something the same way over and over again
Yep.
by just snap, crack, pop,
Yep.
and then sure, it's going to give you some sort of immediate release. But it's not fixing the problem, the underlying problem. There's something wrong, and it's just going to keep occurring. It's going to keep occurring.
Yeah.
And I don't see, and I've had this experience with them, and I've even sat up after the practitioners said, basically, that's you, because it was crack, 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 and I wasn't even in there for 10 minutes. And I said, dude, you haven't fixed me. It's not right. And he had to put his pen down at his desk and go, oh, all right, well, I'll give it another crack.
Yeah.
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 Excuse the pun.
Yeah.
Like you could see it very early on that the writing was on the wall that this was just a lot of smoke and mirrors, And then I sought other help to fix the problem.
Yeah. Yeah.
Which got to the root of the problem. So
Yeah. Look, they have affectionately been known as the Collingwood of allied health. You either love them or hate them. So you will get a very loyal band of followers that just they love their chiro, and that's
it's hard to watch though. It's hard to watch.
And some I mean, it's a great business model. They're getting plenty through the door in quick succession. So
they're doing more than what a GP would on an hourly basis.
Yeah,
GP at least gives you 10, 15 minutes.
Yeah,
but you very rarely use it though, do you?
Yeah, but and it's over the years. We'll have a lot of patients that have had, like yourself. You've tried a chiropractor and it just hasn't quite worked for you. But it's pleasing when people will, either through word of mouth, they'll say, "Oh, I've got to try this osteo," or "I've heard a bit about osteopathy. Let's give it a go," and they do. And hopefully, it is that case then of, will we spend the time, that one-on-one time where we are listening to the complaint, we're trying to get to the bottom, the sort of the root cause of what's driving that pain, what's driving that restriction, and then we can do the hands-on, but then we can give you that extra education, and hopefully that sets a really good, blueprint for you then, knowing, okay, well, this is how I try to avoid it from happening again.
Yeah, and once again, that education is like, this is the reason why it's happened.
Yeah.
This is what we're doing to fix it, and this is what you should not do to make it happen again.
Exactly.
It's easy.
Yeah.
So what do you think your referral rate is on people on word of mouth? Because you've done a good job. But is it a big percentage of new clients?
Yeah, it'd be somewhere between 50 to 60%.
Wow.
Yeah, and that's when you feel a lot of job satisfaction. Then clearly, well, more often than not, we're doing a good enough job for that person to happily say, "Hey, give this a go. See this person, or go to this clinic," or it's a combination of that. Obviously, where you're located can be obviously critical as well. Things like what you might have on your webpage, information there that people can look at and make a decision based off that too, is also important. But fundamentally, I think most good practices will evolve from that idea of word of mouth.
Word of mouth, which is great.
Yeah.
Saves on marketing costs.
Oh yeah.
So how many? Do you know how many clients you've got on a regular basis on your books?
Look, yeah, we have a rough, call it a target that we like to try to hit, based on how many practitioners are available for that week. Again, depends on, I'm, as the business owner, I'm there pretty much all the time. I don't work anywhere else, but we often have, our contractors will work across a couple of clinics. So it really depends on their shift availability, as to how many patients they can see as well.
Does it get frustrating having to herd those guys, or is it just it's natural and it's easy?
Yeah, and I can understand and appreciate why people in this industry like to work across a couple of places, because you're in four walls, right?
Yeah.
It's there's no beautiful, vista across a river to look at, or, anything like that. So it is about, just your times with the patient, and you want to, optimize that time. But to be across a couple of practices where there's some other team members, you can bounce ideas off each other. It's about what sort of, call it culture you want to set up within your practice. And we try to work on that as one of, it's very inclusive. There's always an open door. It's always, any questions you have, throw them around. There's no wrong answer. It's about just making sure that you're justifying, what you're doing.
I think that's standard for a modern workplace these days, isn't it?
Yeah.
Yep.
Yeah. So
this podcast is brought to you in part by Buckfast. What is Buckfast, you ask? Well, let me tell you. It's better known as Bucky, and it's an internationally enjoyed, unique tasting tonic wine. It's equally rich in heritage as it is in taste. It packs a punch from 15% alcohol and about the same amount of caffeine as a well-known drink that gives you wings. Buckfast's enjoyment is only rivaled by its versatility from the cooking pot to the wine or cocktail glass. Drink it straight, mix it in a Negroni, or use it as a marinade. Available Australia-wide and distributed by Beeblebrox Beverages. Visit beeblebrox.com.au to find your closest stockist, and buckfast.com for cocktail and recipe ideas. Talk to me about the biopsychosocial social model of health. Did I get that right?
no, we're not talking about bikes.
Biopsycho. Talk to me about biopsychosocial model of healthcare.
So,
Please.
yes.
Yeah. Can you say that?
Biopsychosocial
Oh,
model.
biopsychosocial. I said bio.
So not biopsycho.
No.
If I break it down in a way, there's different models of healthcare that we can look at. We've got obviously the modern medicine healthcare, where you see your doctor, they prescribe, or they give you, you go through different tests and so forth. So what we look at when we're looking at patients presenting with a whole host of different issues, and again, predominantly we're looking at musculoskeletal conditions. However, we still try to interpret and then work to a model that we deem that biopsychosocial model. Now, that's not every single osteopath out there, but definitely the majority would follow that model. So if we break that down, we're looking at the bio side of it being anything biological. So we're talking more about the body's cellular structure. So we're looking at, could be muscular tissue, ligaments, tendons, vascular tissue, nervous tissue, and so on. So if there's any call it disharmony, any disease affecting those tissues, that's tying in with that. So for example, a muscle strain or a joint sprain, we're looking at that. So when we hear that from the patient, they say, I've got a sore ankle, as an example, we're thinking, right, well, what biological tissue is maybe affected here? What's the tissue maybe generating symptoms for that person? But what we're also trying to take into account is what else may be imparting influence on that person's experience of pain. Because we've got to look at it as the body is processing an injury, it's then presenting that in a form of an experience, and that being pain. What might also modulate or affect that pain? So we delve into what makes that person who they are. So we're getting into that psychology component.
Okay, so if somebody's obviously twisted their ankle or rolled their ankle, they're going to tell you that immediately.
Yep.
But if that's not the case, you've got to investigate further, which is what you're trying to say here.
Yeah, and it might be, let's say, the case of it's a repeat ankle sprain. So it's not the first time, it's maybe the third time, and they come in and you can clearly see they're really agitated, and you're sort of going, and they're in a lot of pain. You think, wow, this seems a bit, it's just a simple, you twisted on a rock out the front and your ankle went, but you're in agony. So
you'd be frustrated too, wouldn't you? At a benign action.
Yeah, that's right.
Yeah.
And so we've got to then delve into, well, is this reaction above and beyond what we would expect for biological change? And then you go, well, okay, this has happened multiple times now. They're pissed off. they're frustrated at their body for failing them again. So it changes the stress response. All of a sudden, that can change the perception of pain in that area. They may work on their feet as a chef, all day. Now they can't do that because their ankle's sore.
Yep.
That imparts an impact on how their body's perceiving that pain too, because it changes again a different form of stress. That's more, it could be a financial stress now. Oh God, I'm out of work. So that's how we sort of try to tie in through our history taking. We're trying to get a better picture, of not just the biological changes that have occurred, but what might also factor in to that individual's circumstances.
When we talk about stress,
Yep.
do you get people presenting with ailments that you can directly relate back to stress?
Yeah.
Where there's no physical issue.
Yep.
It's stress related, entirely stress related. So a prime example would maybe be migraines. Yes, no, caused by stress, tension in the neck.
Yeah, tension in the neck is absolutely very common, and
Well, especially when everybody's going like this.
exactly.
Yeah.
So, look, things like you can have a person can wake up, one morning with a headache and go, oh, that's a bit odd, and they didn't sleep well that night, and they're worried about finances, or they're worried about an assignment. They're, and it's not until you maybe put hands on that they also realise, oh, geez, I didn't realise that was so sore, and by now you're doing that, that's now influencing my headache. So you can have a combination of factors. So their stress levels have basically been rising, and then that elicits signalling in the way that the brain responds. So, I'll give you, I guess, an example that I often use with a lot of patients will be, it's this empty cup analogy. So if we've got our cup here, and at the moment it's filled up with a little bit, and if we call life stresses can fill up this cup. This, for example, might be you've strained your ankle. So you've got musculoskeletal input that's put some stress into your system, so it's put a little bit of volume in your cup. Now, if you've also, like I said, you're that worker who now can't work, there's a financial stress associated with that. If you are now unable to go on that fun run on the week that you've been training months for because of this, there's going to be an added stress to that. So what we're looking at here is, if you imagine the contents of this cup is your pain experience. And if we think again as like a volume control on the stereo, then as this rises, so too does your volume that way. So what we then try and do is, because a person will come in again frustrated because they've repeatedly strained the ankle, and you might say, hey, look, you haven't necessarily done damage to your tissues that's filling you up here. It's still down here. We need to work on that. But if they can see visually that it's not as bad as what I thought, we can get on top of that. Now, what we also need to do is look after the rest of you as well. So how do we manage the stress that way? So what other exercises can you maybe do in the interim to keep yourself active, to keep your mind away from the worry of your ankle, and so on. So basically, when I use this cup analogy as well, when I come back to using exercise, I say, well, what we can do by exercising appropriately is that increases the size of your cup. So the stresses take longer to accumulate.
Yeah. Makes perfect sense.
Yeah. And so it's about, because stress is this all-consuming beast, right? That unless we can break it down, it just envelops us, and we don't know how then to handle that. And that then has a knock-on effect to other things like blood pressure, to, your gut health and so on. So I think, part of our role is as educators, to say, hey, we'll get you through this, but we need to just look at some factors that we can start to chip away at. And some of those things we can help with, but we can't fix everything, right? So we might have to say, hey, you actually do need to get on top of your pain. You probably do need to take certain medication to control that, maybe anti-inflammatories, maybe, other forms of intervention like bracing or strapping to quieten down that area. And so sometimes we even need like a team care arrangement in place for that person. So it might be getting the doctor on board, or it might be getting another allied health person on board, psychologist on board, whatever it may be. Yeah, but fundamentally we're trying to lower the volume
Yeah.
That
Oh, look, it makes perfect sense, and
Yeah.
a lot of people underestimate how damaging stress can be
Yeah.
on the body. And as you say, if you've got a team around you which are giving you everything that you need to manage the situation,
Yep.
it's just like being in a sporting club. You know, if you've got an injury or you need something massaged or you need to do your stretching, you've got all these people that are managing all these parts of who you need to be the person on the field.
Yeah.
You know, so if we're talking about youth and injuries, what's a common injury for, say, a 14-year-old male who's playing sport
Yep.
and just being a kid? What do you see presenting?
Yeah, we've definitely seen an increase presentations typically involving lower limbs, so around knees and ankles, and what we'll often see is, think of these are joints that require muscle and tendon to anchor to something to enable movement to occur. So if using example around the ankle, the Achilles tendon is that massive tendon that anchors to the calf muscle that comes down.
I'll tell you what, Mav, do you want to just get a bit of anatomy up on the screen for us? If you can get a knee and an ankle or a leg up there, that'd be, just so we can refer to it, would be nice. Sorry, I didn't mean to cut you short there.
That's all right.
I just thought we'd just get some visual cues because
Yeah.
it's
Yep.
like I love looking at the diagrams you've got in your office of just the skeleton and the muscles and just you understand how everything connects to each other.
Yep.
You know, and if you haven't seen that, you don't know it.
Yeah, I was about to say that exactly. Having in the room visual aids, so a big muscle chart and a skeleton, which I use every day without question.
Oh, otherwise you wouldn't have it there because
No.
it's just creepy.
Yeah. Well, Halloween, it's all right. You can get away with it, but that's about it. But
Oh, let's go muscular instead of skeletal.
maybe, Mav, type in SEVERS and put, disease. It's a horrible, it shouldn't be called a disease, but it is. So, to give you an example, Sever's is basically a pulling issue. The Achilles tendon anchors, as you can see on that right picture, down to that what they call the calcaneus or the heel bone. Now you can see where there's a growth plate there as well. So as we hit our adolescent straps, growth is obviously going crazy. And so on those growth plates is where a lot of cellular activity is happening. So bone cells are really just multiplying in their masses through there. Now, if you've got this Achilles tendon that decides to tug into that area, it's like a rave party going out of control, you know, and the inflammation is basically a riot occurring. And so what happens is the poor child is active, they load that tendon, that pulls into that area, usually whilst they're, call it, warmed up, they're not too bad, but it's when they cool down and then they go to get moving again, they go, holy crap, that is so sore. And it's all about this reactivity that occurs around that growth plate and that junctional point where the tendon's anchoring in.
So we're talking about, for our listeners only, we're talking about the Achilles tendon that joins, as you say, back to the heel bone.
Yeah.
That's and so explain to me again exactly what's happening. And in teenagers, we're talking about inflammation caused by
pulling of the tendon on the bony lining. So
the tendon's pulling off.
It's not pulling off, as in it's not tearing away, but it's basically causing. It's like a frictioning of rubbing along that line, lining through there. Now this is what we'll see is it's more prevalent in kids that are very active, and it can depend on the type of sport they're doing as well. So if you can appreciate high impact loading sports like running, so basketballers, netballers, footballers, where there's a lot of stop start, rapid acceleration, deceleration, hopping, landing, and so on.
So you're saying this is fairly common
yeah, it's quite common. And so it gets this term, which is a horrible term, being a disease.
Oh, really? But it's not a disease.
No, it's not a disease.
That's just a natural occurrence.
Yeah, and unfortunately, and we don't know why, but some kids will be more predisposed than others. I don't think there's much difference between the male-female prevalence. I think it's fairly even. And again, it can very much occur. Sometimes it's deemed a bit younger, around that sort of 12-year-old age mark, but anywhere through as you're basically thriving and growing. But it's one too that we want to reassure.
So when you hit puberty, that's when it sort of sparks up.
Yeah, quite often.
And yeah.
So I guess sometimes it might be again thrown around that it's like a growing pain.
Yeah.
It's got a bit more pathological sort of underlining.
Well, that's what your mum's going to say. Don't worry, it's just growing pains.
Yeah, and so that raises a good point, because how are these things then managed? And it comes back to this whole, the biopsychosocial model of, well, we don't want to tell poor Johnny or poor Sally, that's it, no sport, you're done. Well, that's the last thing they want to hear. So
No, not at that age, no.
Yeah.
No, especially when they enjoy it.
exactly, and particularly, again, where you've come out of a harsh couple of years of denied sport and training and hanging out with your mates.
Yep.
And then all of a sudden you're told, no, you can't do that. So you've got to be very delicate with then how you best manage that person. So part of our role, again, is reassuring the child and more to the point, the parents, hey, little Johnny and little Sally will be fine. This isn't a condition that is life-lasting. It will run its course.
Yep.
But there are measures we can put in place now to try to minimise flare-ups and best help that person still maintain a degree of activity.
So even though they call it a disease, it's not.
No.
But they can grow out of it, and it can be managed. And,
Absolutely.
And so it can be stopped in its tracks. Is that correct? Or is it something that may become an issue down the track?
No.
It may flare up, or
It may flare up depending on their self-management.
okay.
Yeah.
So if you're told not to do anything and then you go do something, it's going to flare up.
Well, sometimes some of the worst advice may be do nothing, and then you rest for, say, 3 weeks thinking everything's fixed.
Okay.
And then you go out
Yep.
and play a full game of whatever it is, and then you sort of...
Okay. So what's the normal fix in that case? What are you recommending? What are you prescribing?
If it's inflamed, if it's in that real, swollen, tender to touch, really, hard to load on it. And again, I would often use a bit of a pain scale because again, what you might say is 4 out of 10, another person may equate that's more an 8 out of 10. So we try to use a bit of a scale factor to get relative to what that person is experiencing. So I would normally say, look, anything from 0 to 4 out of 10 is what I call it's an uncomfortable phase. Things are a bit stiff and sore, but you're not in a lot of pain. But if you go beyond that 4 and you are doing any effort or activity that's escalating that pain level, then your body's telling you something's not right, and it then needs to stop and shut down. So if it is in that inflamed state, you sometimes do need to say, hey, this does need a bit of quiet time. We do need to let the body rest and recover. You might need to ice it in that inflammatory phase to bring down swelling, but not for a long-term period. It might be for like 12 to 24 hours max. And then you want to start to get some heat through the area to, again, get the pro-inflammatory mediators in there, but in the right dose. So you're optimizing recovery. Then we start to progressively reload again. And we might then say, right, if it's again using the Achilles area as our example, there might be calf tension. There might be the need to relax off the tension there. So massaging it, get on a roller. It might be some dry needling. It could be all those different approaches to help offset the pulling that's been going further down the line. It might be looking at the child's foot mechanics. They may have horribly flat feet, and that's loading up differently into the foot when they take off. They may have a situation where they have high arches. So it's all about, again, individually working out for that person, right, we need to tackle this mechanical anomaly and try to improve that as well.
So when we're talking about inflammation, you talked about cold and heat.
Yep.
These are both natural and everyday remedies. Do you go straight to a pharmaceutical, like an anti-inflammatory, in these sort of situations, or do you always go, let's just take the natural way out first, and if we don't get a response, well, then we'll look at something
Yeah,
like an alternative.
Yeah, I would always, if we can avoid putting anything into the system that, obviously has to then be processed by organs, particularly liver, kidneys, and if we can avoid that, for sure.
Is it so? If it was your child, you wouldn't prescribe?
Not straight away.
No.
No. I would follow more your standard sort of, what's been. I mean, again, it's standard protocols over time for soft tissue injury management will be that that RISA regime. So you're resting it, you ice it, you compress, elevate, and then if you need to, depending on the severity, you might need to refer them on for further investigation. But more often than not, I work with that idea too, that the juvenile tissues, they're cockies.
Is that? Can you hear that, Mav?
Yes, I can.
That's
or it could be a pack of galahs, just like us.
that's
just
bloody
flying
cockies.
by.
That's I've never heard that in the studio. That's weird. I thought Mav was on TikTok or something.
No.
I looked over and go, "Are you doing your job?" Bloody cockies. Bloody, sorry.
No.
Where were we?
Oh,
We're talking about information.
Yeah, just the following protocols that have been tried and tested over a period of time. It's quite contentious as to should you still ice it or should it just be leaving it all together, let it do its thing. It's how soon do you bring heat into it? Is that going to only add more swelling to the area? Like it's very hard to know exactly what's right for that case and for that person, but more often than not, if we can take the aggravating load away straight away to allow that limb has quiet time to naturally settle and repair, great, let's do that.
Yep.
And if you absolutely have to resort to pharmaceutical intervention, again, maybe that's on the basis of, well, we want that child to sleep well. Again, optimize the sleep quality and so on. I can justify it that way. Yeah. Then
Well,
then
I can fully understand that. I'd be the same way with my son, but as a 50-year-old man, the first thing I do is go to the Voltaren.
Yeah.
It's like, why have I not got any more Voltaren?
Yeah.
But yeah, as you say, stuff like that, they're bad for your stomach if you abuse them.
Yep.
And I know a lot of people I used to play, played rugby in our youth, and they've all got knackered guts.
Yeah.
Their gut lining's destroyed by these
that's it. And I think if
anti-inflammatories.
you're taking this as it's a very short course.
Yes. Yeah.
You're not on it for weeks and weeks, and you are advised to take food, and so on. Well, you're minimising risk.
Well, for our listeners' point of view, if you are taking something like an anti-inflammatory, and the problem has not been rectified in any sort of state after a period of a week, you should seek medical help.
Yep.
Yeah, it's standard. I mean, sure, you can self-manage certain things.
Yep.
But don't be fooled into think that the magic pill is going to fix everything. You know?
Yeah.
And that's why, as I said, the people in my life are the important people that I've got: electricians, plumbers, osteos, a good doctor, a good gym. So
Yep.
from somebody my age, I really rely on all these people and their professional help to manage my health and well-being, and that's what they're there to do.
Yeah.
They're there to do.
One of the more rewarding patients we can see is that one that has been resistant to any form of intervention. They've worked on that, whether it's the way they've been brought up is just get on with it, you'll be right, suck it up, take some painkillers and get on with it. But if we can get those people in and just work again to the root cause, well, why are you in this cycle of needing to top up on an anti-inflammatory?
I think that generation's a dying breed, isn't it? I mean, everybody these days, they need gratification. They need instant, instant answers to their questions, and they'll go straight to Google.
Correct.
And hopefully they'll go get some help from health professionals.
Yeah.
We talked about the gut before. About I've got some notes in here about mental and gut health.
Yeah.
And obviously, it's part of your regime and part and parcel of what you do.
Yeah.
How important is gut health?
Well, it's just becoming such a key area of investigation. I think we're only learning more and more about it as each month or year goes on. I think there's so much more scope for further research because
There hasn't been a lot done in the past, has there? No.
No. So the key word you might hear bandied around now is this microbiome.
Yep.
I don't know a huge amount about it myself. I'm trying to learn and keep up to date with what is happening in that space. But, you know, for the people out there that have had the irritable bowels, you know, celiacs, you know, intolerant to certain, you know, food types, they're the ones that are absolutely going, yes, finally, we're starting to understand more about why the hell it has been a struggle. Why when I, you know, I try to look after my diet, but then I maybe, you know, I sit up all night on my phone, you know, and I don't sleep well, and then I have a really stressful meeting with the boss, my guts go to crap. You know, it's like, I can sort of see now this connect with...
Well, the staying up all night on your phone is a contributing factor, isn't it? If you go to a meeting with the boss, go to sleep early. Go to sleep early, you know? And
it comes back to this, you know, using that empty cup analogy. If you're simmering and all of a sudden the stresses are rising, and these aren't necessarily physical stresses, you know, they're internal stresses, and that's the other thing you often hear. We talk about, you know, people bottle things up. They harbour all this stress and tension, and that's not good. It's like a pressure cooker, or a volcano.
Something's got to give.
Something's going to give.
Something's got to give. Something's got to give.
So I think we're learning more about how do we best address this and what coping strategies can we implement. I think hence things like, well, the cold water therapy as an example, or the mindfulness apps you now see, the breathing exercises, you know, that you can
I'm going to say from my point of view, as a 50-year-old man, it's routine.
Yep.
It's routine.
Yep.
It's and there's all these factors that add up to that daily routine, whether it's an ice bath or whether it's having a crap every morning at the same time, whether it's it's 8 hours sleep minimum.
Yep.
You know, and it's managing time, and with a routine you can do that effectively, and then there's not stuff that's going to creep in or creep up on you and cause you to have some stress.
Yep.
You know, so it's like having a booking system for your business.
Yep.
You know what's coming up.
Yep.
You know you can see what's in line for that day or for that week.
Yep.
But personally yourself, it's about those routines, and people don't see the importance in it, and they just go through life and these things that happen to them and catch them off guard or put them in a stressful situation, which they can quite easily avoid.
Yeah.
You know,
and I think we'll have certain people that they have that mentality of that won't happen to me. I'm bulletproof. You know, nah, I'm fine.
Yep.
But when it happens, things catastrophically can happen. You know, it's quite alarming. Just how many, and you know, it's not until you see a high profile person, you know, die, like Shane Warne. You know, you think, God, no way. That's how did that happen? You know, so I think it's about acknowledging. I think you unfortunately are more on the outlier of having routine, whereas a lot of people don't, and they need to start to hopefully hear things like this, and just it sparks a thought process of, well, maybe I do need to go get things checked, or just have an evaluation of what sort of movement am I doing through my work day. You know, am I drinking enough water to avoid the cramps? You know, am I spending enough time with the family to invest in that and get back that, you know, instead of being bogged down in work. So I think, if more of us out there could, it's again, without sounding too wanky, just stop and pause and just take a moment to think, what are the important things for them?
I think male or female, and especially as you get older. Yeah, as I said, I hit 50, and it dawned on me that I was doing a lot of things right, but I could be doing a lot of things better.
Yeah.
And over those years, I've got that routine thing down, and I see my doctor on a regular basis. I know where my health's tracking.
Yeah.
I get frustrated when I get injured,
Yep.
but I also know that, hey, I've been there before. Although I'm getting older and things sort of degenerate, I know that if I put the time and effort in it and go see the professionals, I'm going to get better.
Yep.
So it's a mindset. It's a mental thing as well too. So everything's connected.
Yeah.
You know, and as I said, as I've gotten older, I've just understand how it all connects.
Yep.
And I know what I need to make me happy, healthy, and a good person to be around.
Yeah.
So
And you're that example of, you've set up a really good highway. You know, your road is quite set. You know, it's clear, there's not too many obstacles, and there will be obstacles that come, but you know how to then navigate around that. Yeah. Compared to being a person who's just a renegade off-road person who's just meandering through not knowing what's coming. And they're the ones that are much more vulnerable to.
Some people don't like to know, and it's frustrating. That's fine, I get it.
Yep.
But as I said, especially with my own health, that's why I get my bloods done every 3 to 6 months. I want to know what's going on.
Yep.
You know, my cholesterol's tracking, everything else is doing fine. Blood pressure, you know, it comes down to, as you say, stress, blood pressure. There's all these other cause and effects things that happen.
Yeah.
But and thankfully for me, as I've gotten older, I've understood it, and I'm acutely aware of how my body reacts to things, and how it should normally operate on a daily basis.
Yeah.
So from our viewers and listeners' point of view, it's just if you think you should be doing something better, there's all these resources out there to help you do that, to be a better person. And I use the analogy as, if I'm not fit and healthy, and I can't be a good dad to my son, you know, or I can't be a good husband to my wife, or a good friend to my mates.
Yeah.
And that's important to me as I get older, you know, which is good.
Spot on.
Yeah, mate. Hey, look, thank you very much for your time. We've covered a lot, and there's a lot of stuff that we didn't cover, which I hope you do come back and see us on another occasion. I think what you do is amazing. I love you, and I love all the staff that you got there.
Yep.
You've done me well, and you will be doing me well over the course of the period. Is there anything you want to say to our listeners about what we've talked? Anything you want to sum up? Anything you want to just finish on?
Look, I'd like to again thank you for giving me the opportunity to come to your wonderful place. It's a great setup. I really hope listeners out there have gained something out of today's podcast. It's certainly been a new venture for me. I haven't done many of these before, but it's certainly good to basically convey a bit about what I do, what makes me tick, and again the importance of trying to live that well-rounded life, keep evaluating the things that maybe can contribute to stress, that you can hopefully try to compartmentalize in a way so that you can lower that volume in your cup, and you can exercise sensibly so you keep that size of your cup large, so that stops the pain from building. And again, it's about taking that moment of gratitude to be thankful for what you have, and live your best life.
Yeah, mate, live your best life.
Yeah.
Amazing. Couldn't have said it better. Hey, thank you very much. I really appreciate it.
No worries.
That's a wrap, Mev.
Yeah, thank you for tuning in and for your time. You know the vibe, I'm steady living until I die. It's a lewd state of mind, and we showed you that. Keep it authentic and real, I hope you coming back. Hey, make sure that you subscribe, cause we got it popping all the time, and it's going down. If you wanna elevate, wanna live a better life, keep it locked here. You know it's a lewd state of mind, let's go.